The past several months have been tough for Craig Wall.
I'm an injector, so when the pain gets bad or whatever, I inject.
He used to take OxyContin, but the province pulled it off the market after concerns the painkiller was being abused. That's when Craig found a new drug of choice.
Heroin. I do heroin.
He's not alone. The Good Neighbors Club, a Toronto shelter, has noticed an increase of heroin use in the community.
It's a significant change, and my understanding is that heroin is cheaper and more readily available now.
I've lost a lot of friends. A lot of people have OD'd and died.
Regions around the GTA are seeing the same thing. At a Hamilton jail, heroin may be related to the death of an inmate and several illnesses. In Waterloo, police are noticing a trend.
Since May, we've had 6 individuals die within our community from drug overdoses, and we're now still working with toxicology experts to determine how much, if any, heroin was a factor.
Heroin use seems to have hit smaller centers harder than larger cities like Toronto, where more drugs are available.
If you're living in a small town and you have, say, 1 dealer or 2 dealers, and what they're choosing to focus on and what they're able to get access to is heroin, then that's what the majority of the community will be using.
Health officials are concerned about oxy addicts making the switch to heroin, both experienced users and especially those using the drug for the first time.
May not know what the potency is, and of course, even when you use heroin, you don't actually know what you're getting for sure.
Outreach workers are talking to users about overdose prevention and calling 911 for help. In Toronto, naloxone kits are being distributed. It can help stop a potentially fatal opiate overdose.
Training somebody, giving them a kit so that they can intervene with a friend or a family member who's overdosing.
Many say getting rid of OxyContin didn't get rid of addiction issues.
The addict will always find something. So when they take the oxys away, they, like I said, they either turn to the methadone or the heroin.
Since they changed it, it's just people are back to heroin's making a comeback.
Jennifer Palisock, Global News.